I don't know how it's clean if it smells and tastes bad.
Flint resident Senegal Williams can't even remember the city's water tasting this bad. Now he's turning to bottled water and avoiding the tap.
It's not proper for people to be drinking, man. If I can smell it, this is not a big debate. This is nothing that nobody can figure out.
That guy was right. There was something very wrong with the water, even though the Rick Snyder administration in Michigan and local officials kept saying everything was okay, even after some of them knew it wasn't okay. One local doctor in Flint decided that if there was trouble in the water in Flint, if there was lead in the water in Flint, then someone should test the lead levels of the bloodstreams of the kids in Flint. That local doctor in September released a study showing that since Flint had switched to drinking water from the local river, kids in town were 2 and 3 times more likely to have elevated levels of lead in their blood. The state of Michigan tried to dismiss her study, but that doctor was right. And forgive my saying so, but if you are looking for a hero in this story, she is a hero in this story, and she joins us now for the interview. Dr. Mona Hanna-Attisha of Hurley Children's Hospital in Flint. Thank you for being here.
Thank you for having me, Rachel.
First, I have to ask you, I just did a big, long rant and summation of what happened here. Did I get any of that wrong? Am I missing any important parts there?
I think that was pretty accurate.
What made you decide to start doing the testing?
Well, I was at my house for a dinner party, and I was having a glass of wine, so all good things start with a glass of wine. And my good friend, Elin, who's a water expert, and she was at my house. She's a former EPA employee. She's like, Mona, I've been hearing all these reports about corrosion and lack of corrosion control in the water in Flint, and, this can leach lead out. This is going to happen. I can't believe nobody's thought about this. She's like, you work up there, and you're in charge of stuff up there. Can you, have you guys looked at the blood lead levels? And when pediatricians hear about the possibility of lead anywhere, we absolutely freak out, because we know lead. Lead is the most potent neurotoxin you can think of. So that was pretty much my call to action.
And lead is a concern for pediatricians because kids are exposed to lead through lead paint, through, there are other sources, and so when you started doing your testing, it's not that you expected there to be no lead evident in kids.
So kids do have lead, but for the last 30 years, the public health world has done a great job. We got lead out of paint, we got lead out of gasoline, we have these great home abatement efforts. So the lead levels every year have been going down in children.
For decades.
For decades, and in the city of Flint. They've been going down every single year. But after this water switch happened, they spiked up.
And when you saw that, how many samples, roughly, were you looking at before you realized you had a statistically significant result? We're talking like a handful of samples or dozens or?
Yeah, so the first time we did our research was just at our clinic. The Hurley Children's Clinic is our residency primary care teaching clinic. We see the most Medicaid, publicly insured kids in the county, and we saw this drastic increase in that population, but our sample size was too small, so I couldn't go screaming from the rooftops. So then we had the idea of looking at all the labs that are processed through our children's hospital. We're the only children's hospital in the area, and our sample size more than quadrupled, and we saw the same findings, and they were statistically significant. We had over 1,700 samples, equal number before the water switch happened compared to after the water switch happened, and that's where we saw this dramatic increase.
And when you went public with that increase, my understanding from looking at a lot of the good local reporting on this subject is that the state, the Snyder administration, essentially tried to discredit you and tried to discredit your work. Is that true?
Yeah, so we, as a researcher, you are paranoid, and we check and we double check and we triple check our work because this was a politically hot issue. But when the state tells you you're wrong, you second guess yourself. You're like, am I wrong? But the numbers didn't lie. And even if you have a sliver of doubt when it's lead you're talking about, you need to go public and you need to raise the alarms.
The kids who have been affected in Flint, and it's a lot of them.
It's every single kid who drank this water or cooked with this water.
You have to tell their families that the lead exposure, whatever harm it causes in these kids, is irreversible.
That is true. So lead is an irreversible neurotoxin that causes problems with your cognition, your IQ, your behavior, but we need to do something now. So our story is not done. Yes, they got this irreversible exposure, but if we bring in resources to these kids now, we can mitigate this exposure. So we are fighting for early intervention services, education services, great nutrition. All of these things can buffer the impact of this exposure. Our whole community's been traumatized. They are psychologically traumatized from this exposure. It's like,
and physically damaged.
And physically damaged, just like PTSD.
Yeah.
It is a toxic stress, but we have to give them hope. They deserve hope. And we have to have this state of emergency to bring in additional resources, which our city and county cannot bring in on our own to mitigate this exposure.
Dr. Mona Hanna-Attisha of Hurley Children's Hospital in Flint, Michigan. You've been through hell and high water in order to get this done, but had you not done this, I don't think we'd be talking about this story right now, and I'm not sure anybody would even be trying to fix it. So thank you.
Thank you.
Thanks.
Thanks for having me.